Hello and welcome to the Department of Global Health and Infection. My name is Melanie Newport and I'm Professor of Infectious Diseases and Global Health here at Brighton and Sussex Medical School, and I'm head of the department. During this short video, I and some of my colleagues would like to introduce you to the department and give you the opportunity to hear a bit more about our activities. In 2003, when the medical school was opened, global health and infection were identified as distinctive themes for the medical school that cut through the curriculum, and momentum grew in this area such that by 2016 a new department of global health and infection was opened. As of now, March 2021, we have 60 members of the department representing academics, researchers, teachers, students, and we have a team of professional service staff as well who support our activities through the administration, coordination and communications for the department.
Teaching global health and infection is a really important part of our curriculum for medics, and not just because of pandemics. Our students, our graduates, have to be prepared from day one F1 to see any patient from any background, as culturally diverse as that may be, and be prepared to deliver the best care possible. And to do that, they need to be able to appreciate that their patient may have different experiences, different expectations, that what they've been exposed to may put them at risk of different things. And so to really be able to deliver the best care possible, they have to be cross-culturally competent, and teaching global health and infection is a really important part of that.
The life expectancy in the UK is 80 years. If you look at another country like Nigeria, the life expectancy is 50 years. Why the difference? Our course here at BSMS looks at the determinants of health and ill health in this globalized world, whether they be social, political, economic, or cultural.
Our research falls instinctively into 4 themes. The first is tackling neglected tropical diseases, or NTDs as they are known, and we particularly focus on those that affect the skin. Now, many NTDs affect people working in very impoverished conditions, and therefore most of our work in this area is in partnership with colleagues in low and middle income countries. The second theme is infectious diseases, and here we focus mostly on bacterial infections such as tuberculosis, antimicrobial resistance, and also hospital-acquired infections, although more recently we've developed a programme of research around the coronavirus that causes COVID-19. The third theme focuses on HIV and sexual health, with projects based in the UK and in Southern Africa. The fourth theme is society, culture and health, and this theme reflects our interest in and the importance of addressing social determinants of health, both in our research and our global health teaching. This is a broad multidisciplinary theme that embraces social science and global health economics, and we reach out across the other 3 themes within the department, as well as to other departments within the medical school and our parent universities, Brighton and Sussex universities.
Research done in the Department of Global Health and Infection is very strongly patient-centred and patient-led. That's fundamental to our approach. So not only do we include patients in the result of our studies, but we actually include them in shaping our studies right from the beginning, identifying priority needs and then helping us understand the best ways of answering the research questions once we're in the community.
An example of this is some work that we've done with vending machines, where we involve different disciplines, including designers of products and also manufacturers, all working together with community members. We were able to decide an intervention that was acceptable and that has proven to be very impactful in terms of increasing HIV testing in the city of Brighton.
There is a growing awareness about the fact that representing health problems as biological and addressing it just as technological is flawed. Global health problem and global health issues are biosocial issues, and it needs a biosocial approach. And it's also important to pay attention to the bigger picture. We need to pay attention to from the molecular to the global scenario?
I joined BSMS just over 2 years ago. In that time, we've set up the HIV Drug Resistance Elimination and Management Network, funded by the Academy of Medical Sciences. The H-Dream Network, as is known, comprises a multidisciplinary team of researchers from Uganda, South Africa, and the UK, who have come together to investigate the health system factors contributing to HIV drug resistance.
We're really lucky here at BSMS to have a fantastic team of young researchers from all across the world. We have PhD students, postdocs and visiting researchers all working to understand how TB adapts to living inside lung tissue. If we can understand how TB can survive in the lung, we can design better drugs and better vaccines to rid the world of TB.
One example of how our research is impacting people's lives comes from podiconiosis, the disease that I'm most interested and involved in. So only 10 years ago there was no state provision for patients affected with this disease in any country in the world, but now 3 countries at a minimum have policies addressed towards podiconiosis, have health professionals trained to deal with the consequences of the disease, and have programs running now that patients can access.
We have a very strong philosophy of partnership within the department, working equitably with partner institutions around the world. So beyond the UK and Europe, to work with institutions based in countries in Central and South America, Sub-Saharan Africa, the Middle East and Asia. We also have a very strong commitment to training and capacity strengthening with our partner institutions. For example, we have a very active PhD programme and support our early career researchers. Now, some of these are based in the UK, but many are based in their home countries where the conditions that we work on, such as NTDs and tuberculosis, are endemic.
When I've tried to convince academics to partner with BSMS, I've said to them, BSMS is a great place to work. All my colleagues are very nice and the bosses are supportive and have a genuine interest to see you flourish in your areas of research, and that's really valuable to me, and I hope they find that important as well.
Well, I hope you've enjoyed hearing more about the department and the activities we do, both in the UK and abroad. If you'd like to find out more, then please do visit our web pages. Here you can find out more about the research that we do, about the Global Health Masters programme and what our previous students have thought of the programme, and also there are profiles for all members of the department where you can find contact details should you wish to find out any more from a particular individual in the department. We really look forward to hearing from you, and thank you for your visit today.